I placed one of my patients on some anti-glaucoma medications and drops. Yesterday, she came back for checkup. That was after 1 month of using some of these medications. While I was talking with her, trying to find out if she's responding to treatment and if there's any improvement, she told me yes. And then she told me how she's scared of using one of the drops that I prescribed for her. I think sometime last day, one of my patients also complained about a particular eye drop hurting her. This one said whenever she drops this eye drop, it's hurt her for like a minute before the pain will stop. That she usually feel pepperish sensation whenever she drops this eye drop. So I was worried because glaucoma, managing glaucoma patients, we need them to be consistent with their medications or prescriptions. So I didn't want anything that would interfere with my treatment plan. I saw how she frowned while explaining to me, and I knew that if this continues, she's not going to use that medication and my treatment will not be yielding anything positive. So I had to call the pharmacy department to find out if the hospital changed company that supplies us with this medication. And when I called, I confirmed that it's still the company that supplies us with the ones we have been using, that still supplies us with current medication. So I was wondering where the problem is coming from. So of course, why I called, you guys know where we are. We are in Nigeria, and anything is possible. It's possible for them to produce adulterated medications and supply to us. I started thinking of what could be the cause for her feeling pain, because I know she's not supposed to feel pain using these particular medications. So that was when I immediately said, okay, well, how do you use your medication? How do you use your eye drop? She told me, doctor, I just used to raise my head up and drop it. I said, is that how you drop it? She said, yes. I said, okay. Now I know where the problem is coming from. It's because of how you drop your eye drop. That is why you usually feel that pain. Now this is an artificial eyes. We call this ocular prosthesis. You see this black part of the eyes. If you look at it very well, you see that it is shiny. On this black part of the eyes, there is a fibrous transparent tissue covering this black part of the eyes, known as the cornea. This cornea is an agibota. This cornea is very sensitive. Any small thing, you don't start to shout. That is why when you're in the bathroom having your bath and soap mistakenly enters your eyes, that pepperish sensation you usually feel in the bathroom is because of this cornea. And this is the same thing that happens when you wrongly drop your eye drop on this part of the eyes instead of inside the cul-de-sac. See, let's tell ourselves the truth. All these medications, they are chemicals, both the ones in form of tablet, form of injection, the ones in form of eye drop, all of them are chemicals. Because this part of the eye that I told you is sensitive, if you drop this thing on it, it's going to give you that pepperish sensation. Once you are dropping it on this part of the eyes, once you raise your head up and drop this eye drop on this black part of your eyes, you are going to feel pepperish sensation. In order to prevent this, if you want to drop your eye drop, whether you're doing it by yourself or someone is helping you, let the person pull down your lower lid. When they pull down your lower lid, you can raise your eye up. There will be space here. This space, we call it cul-de-sac. I've made plenty videos talking about the right way of instilling your eye drop. So this is the only place you are supposed to be dropping your eye drop, the lower lid. If you do it on that black part of your eyes, it's going to hurt you. So was this video useful? Please don't forget to share, like, comment, and also subscribe to my YouTube channel if you have not done that.